Diabetes is a huge problem in Stockton. Over 50% of adults have either diabetes or prediabetes.
The diabetes problem in Stockton has been of concern for some time because there is a lack of resources for many of the residents that live here. Since I've been with community medical centers for the past 7 years, I've been able to see how our medical providers are overwhelmed. We have patients coming in diagnosed with diabetes that need a lot of support. Having a program like this will allow me to be an advocate for patients, especially in the Hispanic community when there are those language barriers.
I've seen too many of our people die. I've seen so many of our people, not have a chance, and it's mainly because they don't have a lot of people that they can trust. I have my mom, she's actually type 2 diabetic. It just really hit home for me. I think that once we have more minorities that specialize in diabetes and have the background in education, then we can help break the stigmas.
At my internship at CMC, my job is to educate patients on nutrition and to identify barriers and to reduce the barriers. As someone who has diabetes, it really gives me an advantage in working with people who have diabetes because I'm able to take a more empathetic approach. I actually understand when they tell me I don't want to check my blood sugar at work. I am able to identify the stigma through lived experiences.
What I enjoy the most about this internship is that I really get to have an behind the scenes look as to what these therapy sessions look like with patients. And so being a part of this internship allows me to see the type of therapy sessions and counseling that our patients receive. This scholarship means that I will be able to advance my career within community medical centers, which will allow me to continue to provide supportive services for members of the community.
Without the Abbott Fund scholarship, it would have made it impossible for me to continue my goals and my dreams of becoming a social worker. Having the diabetes concentration is going to open up many doors for me and so many others.
The Abbott Fund scholarship made it possible for me to go to school. As a single mother of 6, I couldn't afford the tuition. My kids are my motivation. It means everything to me for them to see me obtaining my master's and showing them that anything is possible.
The difference that I hope to make in Stockton is to increase awareness about diabetes, especially within the African American community. And I also want to be someone that people can come to and feel comfortable talking to about their diabetes.
Diabetes is a life-changing diagnosis, and through this program, I hope to better serve patients that are diagnosed with this condition.
The number of African American women who are licensed clinical social workers is extremely low, and I hope to change that statistic by being a role model for others.